Okay, well, hello everyone. Thank you for joining us. My name is Audrey, and I'm on the corporate team at New Life. And today we are going to just really explore the synergistic benefits of how we can pair biologics with peptides. And today you're going to be hearing from our Chief Medical Officer, John Stavrakos from Heritage Regenerative Medicine. And he has been an integrative physician for over 25 years. And he's really been a specialist in biologics for about the past decade. And so we're going to hear from his expertise. And then we also have the CEO of My Practice Connect, Dr. Brent Egan, who is going to be reviewing with us and getting into a deep delve on the peptide side of things. Dr. Egan has
Yeah.
also been an integrative physician for about 20, 25 years, and he has really been on the cutting edge and the forefront of the anti-aging peptides. And in his own personal practice, he's also started incorporating the biologics with the peptides as well. So you're going to learn a lot of information from both of these gentlemen and how you can improve your patient outcomes and just really how well these modalities work together. Because in my industry and line of work in the biologics, I never claim that the biologics are the end all be all. There are other modalities that we can incorporate in that will make the cells do their jobs better. And now I will let Dr. Stavrakos take over.
Oh, well, thank you, Audrey. Thank you all for attending. I really appreciate you coming and listening to us. We're going to pass this back and forth between myself and Dr. Agan. I'll just start things off. And our topic is, as you can see, the synergistic benefits of biologics and peptides. And it really is a synergy. It's a force multiplier. It's not a 1 + 1 = 2. It's 1 + 1 = 4 when done correctly. So my background is much more strongly rooted in the biologics, birth tissue products. Dr. Reagan is an expert, of course, on peptides. So I'm really glad the My Practice Connect and ULIF got together and said, hey, why don't we talk about merging the two in a lecture, because these products work so well together. So next slide, if you could, please. And so this is just briefly me. So I have a clinic in Charlotte, North Carolina called Heritage Regenerative Medicine. My background is simple. I was an anthropology major at Notre Dame. I got my master's from Barry University. And after medical school, I went into traditional medicine. I'm in a physical medicine rehabilitation. That's what I'm board certified in. PM&R is a great field because we call it the waste paper basket of medicine. No matter what your problem is, eventually you funnel down to us. If it's a stroke, head injury, joint injury, our job is to try to get you functional. So it really aligns well with this field. But it was really when I did my fellowship. I stayed at the Medical College of Wisconsin to do a fellowship in women's sports medicine. And I was getting a little dissatisfied with some of the treatment plans, especially for older athletes or athletes with chronic injuries. The answer was, of course, physical therapy and maybe some dry needling and steroid injections and anti-inflammatories. And then basically you stop doing your sport. If you were a runner, you became a swimmer maybe, and then just basically hang on until you're old enough, and then we'll give you a joint replacement. Somewhere around 2012, I really got interested in regenerative medicine. I'd known about it for a while. And then when I started doing it, I hit myself over the head and said, why haven't I been doing this all along? So I got there and never looked back. And that led to really going into functional medicine and really trying to get people better. So I spend a lot of time. I love an organization called the American Osteopathic Association of Prolotherapy and Regenerative Medicine. They do a lot of functional medicine. I work out of Columbia, South Carolina as a medical director of a friend's clinic. And I've had the honor to be the chief medical officer for the last couple years with New Life Regenerative Medicine. I was a client physician for many years before. I've used the products for a long time on not only patients, but myself and my entire family. And it's really been the singular honor, honestly, of my career to work here and the things I've gotten to learn. So like Dr. Reagan, we do hormone optimization, IV therapy, ozone therapy, anti-aging, and some biohacking. Wrote a book a few years ago, and I wish I'd had peptides, called The Athlete's Secret to Conquering Pain. I'm a patient because you can just scroll down to that bottom one where it says Lifetime Achievement Award for doing dumb things that get a body hurt. There's never a tree I didn't want to climb or a concrete floor I didn't want to do a tumbling pass on. You know, gymnastics and martial arts will do a number on your limbs. Now my friends and I dress up in Greek armor and we go to parades and the like. So that's the very short list of things I've gotten treated. And there's only one joint I've not been able to save. I did have to have hip surgery. Hips are hard to treat. Every other joint of mine, I'd have probably had 3 or 4 surgeries by now had it not been for these products. Next one, please. And I'll turn it over and let Dr. Egg introduce himself.
Thank you, sir. Yeah, so real quick on me, I got my bachelor's in my medical degree at Michigan State University. Kind of like John, I feel that peptides and biologics have been in my calling. I'm a college athlete, played soccer at Michigan State University, and then immediately jumped into functional medicine. So it's kind of important, at least from my background, is I never practiced in traditional medicine. So this has been my whole career. I got into residency and immediately realized that to be a board certified family practitioner didn't have the interest that led me into medicine, and so I quickly turned into kind of taking things my own direction and jumped into concierge and functional medicine from the beginning. So it's been a beautiful journey for me because I have never ever had to work inside a traditional medical practice, and so I have spent my whole career working on trying to figure out better ways for people to live using lifestyle as medicine, and of course looking at biologics and peptides and any other modality that could help us achieve living the best we can without needing, not getting sick and not obviously falling down into traditional medical pathways. I've been working on this for a long time. At the beginning of my career, I started out just in, normal functional medicine, focusing on nutrition, fitness, hormones, exercise. And then about 17 years ago, I jumped into psychedelics. I started to realize that there was a very interesting problem at hand, which was that we had no cures for neurological disease. And it could be mental illness, neurodegenerative disease, without being any cures. You can fix the body, but why can't we fix the mind and the brain? And so I jumped into that, started doing ketamine therapy and other psychedelic therapies, and found that that is the last pillar, I would say, of functional medicine is psychedelics. And you're going to see that the rise of psychedelics is going to be powerful in the next 10 years. It's already starting. But it's pretty simple when you can't change anything without changing your mind. And so once I got into ketamine, that helped me personally, and obviously kind of invigorated my passion for functional medicine, because now I could work on finding ways to help people change their minds, which of course in turn help them change their bodies. So that's pretty much on me, and I love peptides, and I love biologics and how they work together. So I hope that we give you a lot of good information that you can either take back to your clinics or use for yourselves or some of your friends and family.
Brent, thank you. He said it perfectly. Once you go down this rabbit hole, once you swallow the red pill, if you saw the Matrix, you just can't go back. You realize this is really what we call alternative medicine now, really was what medicine was until the early 20th century. It was when they realized they could make a fortune, J.D. Rockefeller specifically, and said, hey, I can make a lot of money off the petroleum product to make pills, and we're going to shift the curriculum. But more and more, we shouldn't call this. I think RFK or Robert Kennedy said, this should be called medicine, because this is really what we're doing. We're trying to treat people. So this is my I love quotations, and I really like, this is an Irish one. We squander health in search of wealth. We scheme and toil and save. Then squander wealth in search of health, and all we get's a grave. We live and boast of what we own. We die and only get a stone. Why do I say that? There are millionaires out there, guys, who would give up their entire fortune to get out of that wheelchair or get off their dialysis machine. They'd give everything they had to be able to walk again. And as a PM an hour rehab doctor, I see stroke, spinal cord injury, some horrible conditions where people's quality of life is gone. It starts with good health. A sound mind and a sound body will take you anywhere. So never underestimate that. And our whole here, if you go to the next slide, please. We'll talk about that. There's a quote from Desmond Tutu, I'll say. So really what we're going to talk about today is you're going to see this word HCTP a lot. For those of you in the field, that's human cell tissue product. These are the birth tissue products, the cellular Wharton's jelly, or medicinal signaling cells, exosomes. HCTP is a simple way to say it. Definition of regenerative medicine. I'll segue over to Dr. Agan. He can talk about peptide therapy, the definition and its uses, and he's going to give us a really good tutorial on good ways to combine them. And then just some good, I have one or two examples you can give, and we'll give our closing thoughts. So, next one, please. Thanks. I love this quote by Desmond Tutu, and he was talking about it obviously for economic and social issues, but it applies here because this is really functional medicine in a nutshell. He said, there comes a point when you need to stop pulling people out of the river. We need to go upstream and find out why they're falling in. You can give people anti-rheumatic DMARD drugs for autoimmune all day long. When you don't look at the root causes, when you don't look at what's wrong with their body, when you look at when they're vitamin deficient, and you start supplementing them, get their gut healthy, and having their body heal themselves, it's amazing how people make a turnaround. Next slide, please. So keep that in mind. We're looking at causes. In terms of HCTP, so as you know, the interesting part about being the chief medical officer for New Life is I get a lot of questions out of left field because there's a lot of people out there with a lot of severe conditions, and I'll get phone calls and saying, what would you recommend for this condition? And sometimes I got to go through my book and say, I think I read about that during my boards, all those years ago. And you realize, and you do the medical literature search, and you realize, wow, there's actually a lot there. So obviously COVID-19 was a big issue over the last few years, particularly with people who were sick with low vitamin D. And sure enough, there was a great study out of University of Miami Hospital, Jackson Medical Center. So they took severely compromised COVID-19 patients. Most of these patients were elderly. Many were on a ventilator. I always say these are the kind of people that had 1 foot on the grave, 1 foot on a banana peel. And we're given 200 million cells over 3 days. At 1 month, 91% survived versus 42% in the control. Less than 85 years old, 100% survived at 1 month. Look at time to recovery. Half of them with MSCs recovered went home within 2 weeks of the last treatment. And by day 30, 80% of the treatment group recovered, less than 37% in the control group. That's astounding. Next one, please. I get a lot of questions, of course, about autoimmune issues, chronic inflammatory conditions. Lupus is a big one. This is just a smattering of what's available out there. And these are just studies I share with people. These are available to anybody. If you have a subscription to PubMed or Elsevier, you can find these. You see the effect of these drugs. Excuse me. They do a great job of suppressing inflammation. So we'll talk a little about the immunomodulatory effect. Next one, please. So if you get questions about, well, my friend has lupus, I have someone with RA, irritable bowel disease, Crohn's or ulcerative colitis, lots of literature. And these are just really simple ones. I've seen it personally in my career, professionally, but it's nice to know because obviously no matter how busy you are in your clinic, your biostatistic value, your N value might be 10 or 20. I've had 100 patients. Well, does that mean a lot in the grand scheme? Maybe not. But when you start seeing thousands and thousands of patients from studies around the world showing the benefit of these products, you start realizing there's something to them. This is not a flash in the pan. Next one, please. Here's one out of left field. I got this question a couple years ago. Can you do anything for light chain amyloidosis? So this, as you might know, is a genetic condition. It's a deposition disease. The proteins that are formed don't fold correctly, and they basically end up as something your cells can't use, and they end up depositing themselves in various tissues of the body. So these patients get horrible arthritis because it ends up in their joints. It almost feels like gout. Their kidneys shut down because they deposit in the nephrons of the kidney. They start getting cardiac issues. They start getting dementia. It's a horrible condition. So these guys have over 20 years of experience. And the take-home message here was, what did they find? When patients who were treated versus the control group lived an average of 122 months longer than the control. That's over 10 years longer. So again, you realize there's really something to these products when you have a disease like this. Next one, please. So what are HCTPs? So the regulatory definition, articles containing or consisting of human cells or tissues that are intended for implantation, transplantation, infusion, or transfer to a human recipient. And there are a wide variety of products. You'll notice I tend to stay away from the word stem cell. And those of you who have clinics, I'm sure you probably know this. We don't use that word in our literature a lot. Why? It's kind of general, and unfortunately, a lot of people have misused that word. They'll give people amniotic fluid, and they'll say stem cell because we think we saw some stem cells under the microscope. So it's kind of, I hate to say, it's almost become a dirty word, and through no fault of its own. It's like saying gun in an airport. There's nothing wrong with the word gun, but in that situation, you probably don't want to use it. So I like HCTP because it really encompasses the totality of what we do. Next one, please. So the two products I'll talk to you the most about are the ones we call Restore and Rexo, and these are simply the trade names that New Life uses. Restore is our cellular Wharton's jelly. These are our MSCs, the medicinal signaling cells that come from the umbilical cord. Rexo are the exosomes, and we'll talk about those in a minute. And the charge products are the same products, only a slightly more dilute version, and we'll talk briefly again about where those might be appropriate. Next slide, please. So the umbilical cord products, keep in mind, if you've ever been in a delivery, it's an amazing thing. When you cut the cord and they tie it off and mother gets the baby, obviously you're left with this long umbilical cord. If you ever looked inside of it, it looks gelatinous. It looks like Jello. So we call it Wharton's jelly. You know, there's two veins in an artery, the allantois, and then just wiggly stuff. And what's in there? Well, you have the highest concentration of birth tissue products of any tissue on the planet, bar none. So the Restore, the live cells come from the fetal side of the umbilical cord. What is that? Why is that important? It's not on the mom side. It has no contact with tissues and things. So people ask me if mom has this condition or nanoparticles, they don't get in there. I've had a long talk with our chief scientist about that and said this is a fortress unto itself. So we have the cells, but you have other issues in there. You have proteins, you have anti-inflammatory products, you have hyaluronic acid. So they have a strong anti-inflammatory effect, and that's the immunomodulatory part. In case patients ask, this always comes up. No, there's no harm to the mom. You know, no, these are not from aborted fetuses. And I just tell people when the baby's born, cut the cord. What used to be medical waste is now a gold mine of products that treat people. The New Life, like any good tissue bank, is in compliance with the FDA and the American Academy of Tissue Banks. Those of you who do this know that. You typically fill out a form when you're done seeing a patient. You put the lot numbers, the information, the patient's name and info, and you hand that over to New Life. And of course, that way, if the FDA ever audits us, we can always match donor to recipient. And these are registered as a human cell tissue product, you know, under 21 CFR Part 127 and Section 361. Translation to me, it's all legal like. So people will say, you know, you'll hear this a lot. These clinics are going under the behind the back of the FDA. I promise you, the FDA knows what I had for lunch yesterday, or they can find out. This is all above board. This is well known. These are regulated products that, if used correctly, you know, work wonderfully, and there's not an issue. Next slide, please. So exosomes. Exosomes are fascinating to me. You know, I've been using them for a couple years. I tell my patients that if you think of a cell as like a flower, an exosome is like a spore. If you are a Star Wars fan like me, if a cell is a Death Star, the exosome is a TIE fighter. That's its relative size. They're tiny. They're nanoparticles. They're about the size of a virion, you know, or a viral particle, about 10 to the minus ninth in size. What's in them? Well, they have growth factors. They have messenger RNA. They have cytokines. They have this really cool substance called microRNA. And microRNA is really fascinating. And I'll talk about that a little bit. I almost always use these in conjunction with the cellular Wharton's jelly because they have a wonderful immunomodulatory anti-inflammatory effect. And it goes well beyond just joints. It goes to intravenous as well. The cool thing about them being so small, in and of themselves, they can cross the blood-brain barrier. Stem cells, as I think you know, if you want to get them in the blood-brain barrier, you have two options. You can do an intrathecal injection, an epidural. You have to, you know, pierce the thecal sac. Or you can do a protocol where you hang a bag of mannitol, and mannitol will open it up temporarily. Not everyone wants to do that. Exosomes go right through. Next slide, please. So this is Restore Charge. And again, this is simply a more dilute version of the cellular Wharton's jelly. So for example, if a typical 1 ml vial of Restore has, give or take, about 5 million cells, a Restore Charge may have about 1 million cells. What's in the substance are exactly the same. When do we use these? Well, we can use them as a volumizer in some cases. I like them in a maintenance program. So for example, if I'm treating someone, let's say hypothetically a joint like a knee or a shoulder, I'll use my Restore and Rexo, start out with maybe with some PRP. I'll do a couple treatments along the way of other things, and then about 6 weeks later, I will do the charge products as a booster. Someone, for example, is doing an aesthetic treatment. They may want to do the main products initially, and then come back. As you probably know, if you do facials or hair treatments, you often have to repeat them. A couple weeks later, use your charge products as well. So they're great maintenance for people like me who are older and still think they're an athlete, but they need something to just kind of keep them going. They kind of help keep you healthy. Next slide. So basically what we already said here. Next slide, please. So why do we hurt? Well, people who are DOs understand this, chiropractors know this, most MDs have no clue about this, they have to learn this. We have a limited ability to repair ligaments, tendons, and joint cartilage. They have poor blood supply. Pound for pound, they're stronger than steel. And they'll get you about 20 to 25 years of good use, because from an evolutionary standpoint, we only used to live about 20, 25 years. 10,000 years ago, that was about it usually. As we get older, these tissues will get little micro tears and problems, and that affects stability. And as you probably know, our connective tissue does not have a lot of great blood supply, not great healing, but they sure have a heck of a lot of nerve endings. So when these tissues start to hurt and we get instability at joints, this is perceived as pain. Next slide, please. So why is it an effective option, or when do we use this? I tend to target, I always want to inject in joints, but I will often target ligaments, tendons, and joint cartilage. If you can stabilize a joint, it's like going underneath your car and making sure the wheels are aligned, making sure that they don't wobble, making sure that the alignment of the front axles with the back axle. If you can do that, you don't get undue wear and tear through the improper alignment that's going to grind on the wrong joints. So when someone comes in your office and they're skeptical or they're not sure they want to do this and you're not sure, well, if someone's gotten adjustments, either osteopathic adjustments, chiropractic, and they don't hold. DOs and chiropractors are my best friends because they think like I do. And they'll tell me, I've adjusted this guy and his back is better and the tinnitus in his ear is better from neck adjustments. I cannot get his SI joint. He'd come in every other day if it were up to him. That's a connective tissue issue. That's a good one. Are the ligaments and tendons tender, particularly at the FOJs, the fibrosseous junction, where the ligament or tendon attaches to the bone? That's typically where you get the problem. One great thing, usually it's pain is less when you're mobile, but it hurts when you're like standing up. The old man noise when you do that in your back. That's often the case. A great one is if they're not sure and you want to be sure, take a little bit of anesthetic. And just like for example, the iliolumbar ligament in the back, or find an area where they hurt, take a 30 gauge or a 27 gauge needle, put like a cc of lidocaine there and rub it in and say, how does that feel? They go, oh my God, that's amazing. Well, that's probably going to be something you're going to want to treat. And that gives you an idea that that's where one of your problems is. Next one, please. So I always tell people from a scientific standpoint, what is the dual role of HCTPs? In one hand, it's paracrine, and the other hand, it's immunomodulatory. Immunomodulatory is what's going to hit you first. Why? Medicinal signaling cells, like the Restore, for example, have the ability to modulate innate and adaptive immune responses. They inhibit pro-inflammatory reactions, and they stimulate anti-inflammatory activity. Why do I like exosomes? They enhance this. So I mentioned microRNA before. When you have inflammatory molecules in your body, for example, if you've got a really messed up knee, you've heard it. If you drew fluid from that knee or plasma and you pulled it from the other knee, you would see a very high concentration of things like substance P or CGRP, these inflammatory modulators. And of course, pain is your friend in many ways. Pain tells you something's wrong. The problem is it never shuts up, and it becomes very difficult to deal with after a while. What does microRNA do? Well, we all know it goes from DNA to RNA to proteins, right? The RNA is ultimately the blueprint that your body's going to make those base pairs and make the proteins that's going to make that inflammatory molecule. MicroRNA inserts itself into the code and basically screws the whole thing up. So a good example would be like if you're typing a website, like you're typing for Google, or Amazon.com, you're going to buy something and something distracts you and you start typing a couple other digits. So instead of Amazon, you type in AMA, GB, parentheses, hashtag.com, hit enter. What will it say? URL not recognized, right? We're getting a lot of URL not recognized with the microRNA. So what happens is your pain goes down quickly. And what a lot of people will find with these is that their pain will recede. Now, I warn patients that that's great, your pain's down, but please be careful. You haven't really started to knit together yet. That's where the second role comes in. Your paracrine signal is a cell-to-cell proliferation. Because what we know about the birth tissue products, I used to think, because if you're putting these, day-old products into somebody, these day-old stem cells, from a newborn, they're going to turn into your ligaments and your tendons and your blood vessels. The reality is they are more the job foreman than they are the worker bees. Their job is to send a signal out to your body from cell-to-cell communication. It's a beacon to tell your own stem cells to come to that area. Your bone marrow has them, your fat cells have them, your colon has them. That's going to take time. So one word of advice I give people is if you do someone who's got a bad knee or a bad shoulder and a week later they're feeling awesome, I warn them that is awesome, but take it easy. Don't rip your stitches. You're going to be healing over weeks to months. So that's the beautiful role. The immunomodulatory is great with autoimmune because they start feeling better quicker, and it gives your body time to recover while you're still feeling good. Next one, please. What are the potential uses? There are very few reasons you cannot use them. We know musculoskeletal. We've been using them for the longest time. I would challenge you to find an NBA, NFL team, English Premier League team, major sports team, even high schools and colleges that are using them on athletes. I personally know a couple, professional athletes who do this. There's a big reason why, along with, of course, peptides and nutrition and sports science, there's a reason why quarterbacks in the NFL are playing into their 40s and running backs are playing into their mid-30s. That never used to happen. This is a big part of it. Systemic diseases, neurologic, rheumatologic, even toxic. You probably know that stem cells have a natural antibiotic in them called LL37. We've seen it work with Lyme. We've seen it work with pneumonia. And there have been cases where they will use it for forms of sepsis and work extremely well. And of course, the aesthetic anti-aging. It's why you get guys like a Tony Robbins, who does a lot of these, who's 68 years old and looks like he's 20 years younger and could probably bench press a Buick. So there are great advantages to these for many conditions. We've seen it with spinal cord injuries. As long as part of the cord is intact, we're seeing things that I was told, because one of PM&R, part of our big thing is spinal cord injury. After a couple months, what you've got, you've got. If you can't move your legs at 6 months, you're never going to move them again. It's not always the case. Next slide, please. So I'll talk about some contraindication, then I'll turn it over to Brent, and he's going to take you on the journey of peptides. When do you not use them? That's important. That's probably more important to know is when you should, because we all get starry-eyed about, oh my God, we can do so many good things. And it's always good to pump the brakes and say, when should I be careful? The first rule of medicine, the Hippocratic Oath, is do no harm, right? So severe hematologic disorders. And when I say severe, I mean people who have bad forms of hemophilia, where like you cut them and they could bleed out, or the extreme clotting, like antiphospholipid syndrome, where they literally have had clots in their legs and DVTs and pulmonary embolisms. You may want to be careful and see if you can mitigate that somehow. Carcinoma is an interesting one, and I'm speaking from a medical legal standpoint, unfortunately, as much as a medical standpoint, because we are a very litigious and legally happy country. There are countries, we did a seminar in Vietnam a couple years ago. I got to go there, and they're using these to actively treat cancer. But is there a theoretical risk it could actually wake up a dormant cancer? Theoretically, yes, it's possible. I haven't seen it. So my general consensus, and this is me, you don't have to follow what I do, but active carcinoma, I want them in remission for at least 3 years, typically. Cardiac instability, if you're in the middle of a stroke or a heart attack, deal with that first. Body-borne sepsis, again, I will be honest with you, if it were my dad or my mom, my late father or my mom, and she was in full-blown sepsis and I could get in the hospital and I could basically infuse her, I sure as heck would. From a medical legal standpoint, I would probably wait till the sepsis is cured. I like to avoid cellulitis in the area. I generally do not treat smokers. Smoking's horrible for you. And it goes to compliance. I have a piece of Hippocrates' tree. It was one of my greatest gifts. The world's first physician, 2,000 years ago, on the island of Kos in Greece, he lectured the first medical students under an olive tree, and I have a piece of that, and I've got that thing saved. He had a great saying: before you consent to treat someone, ask them if they're willing to give up the things that made them sick. So if you're in, you have alcohol abuse, drug use, smoking, and there may be means to get them out of that, but I usually say we've got to get that under control. You're just not going to heal well. Untreated psychological conditions and non-compliance. So I always tell people, you have to be as excited or committed to treating you as I am to treating you. It's a partnership. And if you are, we can work together. If it's just do what I want, I don't want to change my lifestyle, I would move on. Luckily, those are few and far between. With that, I'm going to turn it over to Dr. Egan here. He's going to talk about peptide therapy.
Awesome. Thank you so much, John.
You bet.
Yeah, that your last slide was actually so informative because it kind of the underlying problem we have is dealing with the medical legal system and as we talk about these therapies. But anyway, so I'm going to get into peptide therapy. The slides are going to have a lot of information, and I'm going to allow the slides to do a lot of the talking because you guys are going to get copies of these slides. So I'm going to go through them so we have a little bit of time so John can come back and talk about a couple of cases. I have a couple as well, and we can talk a little bit. So I am going to move through these a little bit quicker because there's a lot to say about peptide therapy. So real quick, what are peptides? Peptides are just short chains of amino acids, 2 to 50 amino acids. If they're above 50 amino acids, that would be a protein. But that's not a set rule. Like for instance, like insulin is 51 amino acids, but still considered a peptide. IGF-1 is 70 amino acids, still considered a peptide. So they're all similar. They just, when you become a protein, you can be folded over and have a little bit more functionality than peptides in general. Peptides are more signalers. So you can see as peptides act as messengers, they regulate so many critical processes in the body. And then most importantly is what causes peptides to be needed? Why do we need peptide therapy? That's because our normal peptides become dysregulated or deficient as we age, as we become sick, as we're using drugs and alcohol and as we abuse our bodies, these peptides are going to start losing their signaling and start becoming dysregulated quicker. And so that is part of what John was saying is that when what gets us to this point of disease and why we're talking about these modalities of how we can help is because something caused the disruption of normal physiology. And a lot of that is lifestyle and can be preventable. So when we talk about why we need these therapies, we should also focus in on what we can do to prevent them because it's part of the problem, but also part of the solution. So when we talk about peptide therapies, it's, basically taking these dysregulated or declining peptides and actually trying to mimic them or support them with either biologics or other peptide therapies to get the body functions back to what they were doing. So you can see at the bottom, peptide therapies mimic the actions of naturally occurring peptides and proteins. So that's the goal of peptide therapy. Next slide. So varieties, there are tons of different peptides. There's carrier peptides that deliver trace minerals, just like they said. One of them is GHK copper or AHK copper. Signaling peptides send messengers to the cells for trigger growth, repair, anti-aging effects. There's so many of them that are signalers. Almost all peptides signal in some form, but you'd be talking about TB500, BPC, some of the growth hormone secretagogues. You have neurotransmitter peptides modulating neurotrophic factors and dopamine signaling, which is our happy hormones, and neuroprotective and anti-inflammatory. Dihexyl-C-Lank, Cmax, all of these could be considered. And then you have collagen peptides, which we talk about. A lot of these peptides could actually be considered collagen peptides because when you reduce inflammation or you prime the body, you actually can improve collagen and fibroblast proliferation. So, but GHK copper and AHK copper are going to be the ones that you think about. Next slide. So what are the advantages of peptides? One of them is ease of administration. And you're going to find that when you deal with peptides, you're going to find there's a lot of different delivery modalities. It can be an injection, it can be in an IV, it can be in a nasal spray, it can be in a troche, a cream, patches. And that's one great thing. When you look at pharmaceuticals, they usually offer it in a couple forms, but not as many forms to administer. They're highly specific in their actions. As I said before, they mostly stimulate or mimic natural occurring hormones or proteins in the body, which make them safer. Fewer side effects. And this is one key factor with peptides. And when people ask why peptides versus traditional pharmaceuticals, it's because traditional pharmaceuticals use a drug to block a physiological pathway to create an intended effect. But with that, you get unintended consequences or side effects. Peptides do the same thing, but they stimulate your own natural resources or help them along to get the same intended or to block the same pathway to get the same intended effects without the consequences or the side effects. That's what makes them so safe and so interesting because the safety profiles are so much better than the pharmaceuticals. And down at the bottom, you can see they can be combined with other peptides or biologics and other healing modalities. You can put peptides intrasurgically. They're putting them in intraoperatively. You can use them with all different biohacking techniques. You can use them with saunas, red light therapy. You can use them for cosmetics, immune modulating. There are going to be so many different things you can do with peptides. Next. So what are the benefits? You can see the benefits are huge. John touched on that with biologics. You're going to get the same benefits with peptides, and that's why we're talking about the synergy of putting them together. But when you look at enhanced muscle growth and recovery, remember, there's this thing called sarcopenia. As we start aging, we are in a constant battle of muscle loss. So when you look at peptides like IGF-1, all the growth hormone secretagogues, that can actually give some anabolism back to us because we're in a catabolic state. So anabolics are not bad. So anything that can help us regenerate or grow are going to be beneficial as we age. Faster healing and recovering. We talk about, we're going to talk a little bit more about how we can use these combinations in wounds, but you have KPV, you have thymosin alpha. These are also all work at improving healing and improve immune modulation. Weight management, we got the ghrelin mimickers like the growth hormone releasing peptides, ipamorelin. We used to have GHRP6 and GHRP2, but we also have the GLP-1s now, which are, obviously very popular for weight management. Cognitive function, CMAX, Selenk, Dihexa, which is an interesting one. Improved immune function, we already talked about thymosin alpha, KPV is another one. Better sleep influencing circadian rhythms, we got peptides like epitalin, also DSIP, which is one that I'm not that familiar with, but I know it has helped with some people with narcolepsy. And improved mitochondrial function and anti-aging. We'll talk specifically about this, but obviously mitochondria are the key to all health, and then improved skin health and appearance. Obviously, a little vanity goes a long way. So we have plenty of peptides that can help on the aesthetics part. Next. So potential side effects. We just got done saying that there are not as many side effects with peptides as there are with other general pharmaceuticals, but they can happen. So one example is injection site reactions. To me, that isn't really a side effect. That's just part of injecting your body. In all the years of injecting peptides myself on clients to physicians that we've trained, the number of injection site reactions, it happens, but these are little red spots that can happen where you stick a needle in. That to me is not a contraindication or a reason to stop therapy. But some people can get more aggressive reactions. Everybody's different. You can get some sensitivities. Most cases they're very mild. The risk of cellulitis with injectable therapies is very, very rare, very uncommon. I can tell you in my career that I've had to deal with cellulitis minimal. And you would think that that would be something that would happen more often when you're using a high percentages of injectable therapies, but very, very minimal. Flu-like symptoms. This can happen when people are using some of the immune modulators. There's a thing called a Herxheimer's reaction, which is basically when your body, when you introduce some sort of a therapy and it causes rapid cell turnover or rapid cell death, whether it be a virus, a bacteria, they can cause this flu-like symptoms when your body's flooded with, trying to respond to the conditions or that you placed in the body by using certain therapies. It's temporary, but it's part of the process, especially when people are aggressive with some of the immune modulating peptides. Changes in water retention can happen with some of the growth hormone secretagogues, even human growth hormone. If people are too aggressive with growth hormone secretors, especially like ibutamoren or MK677, IGF-1, sometimes you can start seeing some tissue edema in the ankles and in the wrist, and that's just all you have to do is just reduce the dose or take a drug holiday. Altered blood sugars, you can see that with some of the insulin-like growth factor. Remember, it is like insulin, so it can affect blood sugars. Same with, so all of the growth hormone secretors and also the GLP-1s, of course, which are to target directly our glucose levels. Gastrointestinal reactions, constipation, diarrhea, and bloating, also rare, but can be seen with peptides like melanotan and the GLP-1s, which is kind of the hallmark side effect of the GLP-1s. But that can also be minimized when done right by microdosing and doing some other things differently. Next slide. So biologics and peptide therapies together. So you can kind of look at this. We have pre-treatment, co-administration, and post-treatment. And so you can kind of think of the pre-treatment, as we talked about, all these peptides produce signaling and enhance the environment or the tissues for biologics. You almost kind of think of it as a primer, and then co-administrating the peptides together is, potentiating what these things would do together. And then the post-treatment is almost like preservation. So with peptides, we can actually prime the body to be more accepting of biologics. And you can think of that simply. I mean, when you're investing in biologics, you want your body to be healthy so that it actually uses them for the targeted tissues. If you have an unhealthy body, peptides and biologics can be eaten up by your own immune response, and it actually can turn some of these endogenous or your own stem cells to stop signaling the same way. But when you put them together, they synergize by their signaling, they synergize by their functionality, and they work really well together. And obviously, post-treatment, this is what's going to keep them working for an extended period of time. So looking at lifestyle, we talked about it. Lifestyle is the key. Peptides and biologics can initiate healing. Lifestyle will sustain it. But we also talked on that first slide, remember, about why did we get to this point where we need biologics or we need peptides? Of course, you can have injuries. You can have injuries playing sports or living an aggressive lifestyle, but you can also get to this point by not living not living a healthy lifestyle. So if you're not sleeping right, you're not exercising, you're not eating right, you have micronutrient deficiencies, you have chronic stress. These things all will affect your body's ability to manage peptides and also manage the biologics that you're investing in. So you can see here that, optimizing sleep is where our tissue recovery is, where our immune modulation happens. Our stress response eats up nutrients. And so we need a nutrient-rich environment for if we are trying to heal the body. Just as simple as you can think about it is a supply and demand. If we are not giving the body enough energy for it to do its job, it's going to start taking away function from other areas, conserving that energy to be used for specific things in the body, like making our heart work and our nervous system function. It's going to stop bringing energy and putting it towards key areas of our body, like immune modulation, apoptosis, which is getting rid of bad cells. There are certain things that get turned off when we don't have enough energy for our body's natural functions. And one of those things is and so that's how lifestyle is really a very key part of how this whole process works, and why it's very important when you look at those contraindications that John talked about for getting biologics. It's because the body needs to be in a good specific position to welcome these biologics and actually work in getting your best return on your investment. Next slide. So synergistic cellular regeneration, this is just basically the basics of what we're talking about. Peptides are signalers. They're the ones that are going out and setting the stage and priming the body for the biologics. So that's the easiest way to think about it. Biologics are bringing the work to the body. And as John said, they're still signalers as well. So the actual stem cells and the exosomes are doing their own signaling. So peptides and stem cells are all signaling the body to bring their own resources to these areas to heal. And then, just like I said, then lifestyle, sleep, diet, exercise, correcting micronutrient deficiencies are going to keep them working after the biologics and peptides have done their job. Next. Immune modulation. So, just think about thymosin alpha. Thymosin alpha is one of the most powerful immune modulators that we have in regenerative medicine. And just remember that thymosin alpha was actually taken off the market in the midst of COVID. I don't know if everybody knows that, but thymosin alpha was being using to treat COVID. And then there were some doctors that used the wrong words in the medical legal system by saying that it could treat COVID. And next thing you know, the government, in the midst of an epidemic, was able to take thymosin alpha along with some other nutrients like NAC off the market. And that was why, and we were using thymosin alpha heavily during COVID. And so you just have to think of that when our immune system's down in a time during COVID where our body is being, is introduced by some sort of viral infection that our bodies had never seen before. Well, what happens? The immune system is one of the biggest utilizers of NAD or energy in our body. So it basically taxed our immune system to pull all the energy to try to fight this new infection that we had no immune response for. And when it does that, what does it do? Well, that takes away from the other natural processes that our immune system does. So what it did is you saw this rise in cancer, you saw a rise in autoimmune disease, you saw a rise in mental illness because our immune system was being taxed, taking all of our energy to work on specific viral responses. And so you can see that, when we can enhance our immune system, like thymosin alpha reduces inflammation and actually directly triggers to helper T cells and natural killer cells to fight infection. Now you can see why it was removed during COVID if the intentions were to make people sick. And I'm not saying I know that, but it sure seems that that was the reason for removing such a powerful immune modulator right in the midst of an epidemic. Next slide. Mitochondrial support. So, mitochondria do more than just energy. They're kind of they're the backbone of everything in our body. Just as I said, it's all about supply and demand and energy. Mitochondria are what makes and creates our energy in our body. It also produces coenzyme Q10, which is a powerful anti-inflammatory. And when our mitochondria are dysfunctional, that is when disease starts. I believe that all disease has a mitochondrial base. And so when we have mitochondrial peptides like MOTS-c, epitalin, humanin, these are great opportunities, or SS31, these are great opportunities for us to improve our mitochondrial function. Now, the hard part with some of these peptides are that they're not like growth hormones, secretagogues, or BPC-157, which you might actually feel a reduction of inflammation. You might actually feel improved muscle gains. You might see fat loss. You might see your sleep getting better. These do have these types of potential outcomes, but yet these are ones that we take more like glutathione as a strong anti-inflammatory. We use these to improve our mitochondrial function because that is what's going to support reducing risk of disease in the future. So you might not get wowed by using these peptides, but they definitely have a function. And remember, all disease has a mitochondrial basis. So, these ones are important. They have huge impact on our bodies. It's just they're not as well talked about just because they don't give the wow factor when using them. Next slide. So impact on longevity, that's what we're here to talk about. That's what these biologics and peptides provide, is it takes our bodies that are naturally going into a catabolic phase. We're losing muscle, we're losing bone, we're losing neurons, we're losing the cells that keep us alive and feeling great. And so when you look at some of these peptides, like the growth hormone releasing peptides, growth hormone releasing hormones, IGF peptides, all of these help to balance and support the biologics to helping us with our health span, not our lifespan, but our health span. So improving lean muscle mass, reducing body fat, supporting the biologics to improve joints, reduce pain in those joint areas so that we can continue to exercise, improving circadian rhythm so we can sleep better. So it's, again, anabolics are not bad. And so these peptides that create this opportunity for us to slow down sarcopenia, or the loss of muscles, or improve osteogenesis, these are the things that we need to do, and is exactly what is happening when you see advanced aging. So all people after the age of 35 are starting to get in a position where peptides or biologics are going to help in some capacity at some point of their lives if they're trying to stay above the curve. If you're trying to live like in the top 5% of your age group, then peptides and biologics are likely going to creep in at some point. Next slide. Sexual enhancement, very important as well. There's plenty of studies to support that the longer you're sexually active in a good relationship, the better your lifespan. So your health span. So these are just a couple combinations. You can look at it. But these are when you're doing sexual enhancement, either P shots or O shots, which is basically shooting stem cells, PRP, exosomes, along with peptides to enhance sexuality for people that have lost sexual function. They're either men or women that aren't getting the same type of sensations. They're having anorgasmia. They're having lack of erections or lack of lubrication. These are things that can help. And stem cells and exosomes and PRP have been used for years successfully for sexual rejuvenation. And when you introduce peptides, again, you're priming the whole tissues to get better results. And a lot of these peptides reduce inflammation, but they also improve angiogenesis, which is improving or creating new blood vessels, improving blood flow to the areas, and improving fibroblasts and collagen. And so you can see that a lot of these would be useful when doing any of these sexual enhancement procedures. Next slide. So this is one when John talked about some of the contraindications for biologics. A lot of them, again, were talked about because this is the medical legal system we live in. And just as John said, a lot of these conditions, if we were in a position where we wouldn't get sued and could actually practice medicine the way we wanted to, just like he said, if my family members had any of these conditions, I would be the one saying, come on in, we got peptides, we have biologics, we can do a lot for you. But understanding that we do live in the United States and this is what we have to work around, why not use peptides to create or reduce some of these biologic contraindications to set them up to where they can receive biologics? That's where peptides are beautiful. And so anybody that has a chronic condition, whether it's a bad joint or they have a neurodegenerative disease, sepsis, any sort of medical condition, use lifestyle and peptides to get the people into a better state of health, reducing some of these contraindications so that they can be candidates for the biologics. There's so many different ways that peptides can work and they overlap in creating that environment so that these patients that would not be a candidate could actually become a candidate for the biologics. And so this is a very important use of peptides for those people that really could benefit from biologic therapies. Next slide. So clinical stacks, this is just an example. We're going to get into some case vignettes now, but this is just an example of how peptides and stem cells work together and that we've seen these work together. I've seen these work together in every one of these situations that are on the screen here, musculoskeletal, neurodegeneration, aesthetics, sexual health, and wounds. Just in wounds, which was, I'll just kind of leave this off as kind of my entry into to stem cells and biologics was I had a patient that was near 90 years old and had a wound on her lower extremity about the size of a quarter that was open, wet, and obviously still infected. And that was after 2 years of traditional wound therapy, multiple courses of antibiotics. And this woman still had a quarter size open wound, leaking wound on her ankle. We injected stem cells around that wound, and in 6 weeks, the wound was almost closed. We did it again about 3 months after that, and the wound actually completely closed. And that was many, many years ago. And that is when I was like, holy crap, you just don't see things like that happen. And to basically see that in front of my eyes was when I really got opened up to the whole idea of biologics. But you can see this can happen. We've done it. We do it with aesthetics, musculoskeletal all day long. I've done plenty of P shots and O shots for the sexual health. These things work and they're great opportunities. But again, just remember that lifestyle is first. These things are used in adjuvant to healthy living, but very powerful. So no one should sit and live with disease or any sort of reduction in physiology without trying some of these peptides or stem cells or exosomes. So I'm going to turn it back over to John.
Brent, thank you. That was amazing. And I mean, like I said, the great thing, we were just talking about this before we went on, is that when you do these conferences, you feel like a kid in a candy store because there's always someone out there who knows a lot about something that you might have a little knowledge, and you learn so much more. And so I have an intro to peptides. I use some of them, but I'm a 3 or 4 trick pony. I have a handful. Seeing this blows my mind, and it teaches you just how much more you have to learn. So, Brent, thank you for that. That was really incredible. And he's absolutely right. Before I talk about this, the whole basis of functional medicine, I think there's really one disease. It's cellular dysfunction. Usually it's mitochondrial dysfunction. That dysfunction comes from usually a deficiency or a toxicity. And that's what we're trying to address here. You're trying to get rid of the toxicity, find out what's deficient, because the body struggles very hard to right the ship. It tries to get in that state of dynamic equilibrium. So the great thing is your body is your ally. It's working with you. You've just got to do our part. It can be lifestyle, it can be nutrients, it can be gut health, but it's amazing what these things will do to turn your body around. So again, when you learn something, and like every time I go to a conference, if you've ever been to a functional medicine or regenerative medicine conference, you walk out of there with stars in your eyes. I'm going to change the world, and you think about what you can do. It's always good to pump the brakes and realize we do live in the real world. And in the real world, bad things can happen, unfortunately. And they're not always your fault. But as I like to say, unfortunately, it's not what happens that matters. It's what a lawyer can convince a jury to believe. And so I hate to be I don't want to be a Debbie Downer here, but I just want to remind people that it is important to always think that if you're like most of us, you're not independently wealthy, you may have to be doing this for many years, and think about your patient selection. You want people that are on board. Most people, thankfully, who come to my clinic, I have a wonderful group of patients. They've had their come to Jesus moment. They've tried the other stuff. They've been through the ringer. They're frustrated, they're angry, and they really have realized that we're in a broken system. And so this makes it very easy to tell them, you're thinking outside the box, because really what's in the box hasn't worked for you. But that being said, as a healthcare provider, it is informed consent does not really apply unless you've given them a very comprehensive explanation of the mechanism of action of these products. And you can send it by email. I send people, I'll explain it to them and tell them, look, I'm not going to quiz you about this. It's a lot to throw at you. I'm going to email you articles about PRP, stem cells, exosomes, biologics. Here's what they do. Here's how they work. So it's all right in front of them. Full disclosure, what might work, what might not. Most of the time I tell people, really, in most cases with biologics, the worst thing usually happens is they don't work. It's possible. Usually does work great, but be aware of that. There's always, I can't account for everything. Make your consent as comprehensive. New Life has a really good comprehensive form for people to look over and read. It's very thorough, and it just gives them an idea that we think these are going to help you, but understand that, like everything else in life, there's no 100% guarantee. When it comes to peptides, Brent can tell you more about this than I can. I'm a little selective about patients. I really want people who I know are compliant and understand when I say you have to inject for so many days and take so many days off, draw that line, and you've got to take, so many weeks on, a week off. You never want someone to come in and say, well, I missed 4 days, so I did all 4 days in one shot. Is that okay, John? I'm like, oh God. Yeah, I'm a little worried about my license now. So be sure you have people who really get it and are going to follow the program. Regular follow-up and open communication. I'm not a lawyer, but I know this. We all know this. The number one reason that healthcare providers get sued, besides gross negligence, is lack of communication. The arrogant person doesn't call people, doesn't talk to them. That's why I say, when I treat someone, what's follow-up? 24 hours later, usually 72 hours later, a week later, maybe 3 weeks later. And then usually at 6 weeks, I'm doing something else. And often there'll be treatments along the way so I can see them. But the bottom line is, they're there. You can address their issues and their concerns. People don't understand this at the level you do. So what to you is a normal, the Herxheimer reaction is a great example. That can be normal. You can have flu-like illnesses and that feel well. My sick patient, tell them that's okay. But if you don't address it and they worry and they're wondering, what's wrong? Well, that could lead to a problem and a rift between you. Lastly, and these are rare, thank God, non-compliant patients are rare. The one who wants you to do everything but wants to do nothing in return, there's nothing wrong with saying these are elective treatments and saying, I don't think this is not the right clinic for you. Maybe you're better with a traditional clinic or a pain management clinic. I would rather get a bad Google review than have someone file a claim saying you're a quack. You're not going to see this often, but if you do this long enough, it's going to come across. So I always say, do I cherry pick my patients? Yeah, I do. It's a wild field, but really I don't have to. Most patients fit in what I consider a good patient. But be aware of that. You want good results for people. Next slide, please. Combining ACTP and peptides. Well, as Brent would tell you, the combinations are endless. When I see patients, you can give me your medical history, surgical history, your allergies. When I come in, that's all on the paper. I can read that. You can tell me about how much your joint hurts or how long you've had Sjogren's syndrome. But I want to know who you are. What do you do for fun? What are your activities? Are you a type A kind of person? Are you a more laid back kind of person? Do you play in a league soccer team and you run your own hedge fund and you run a charity? You're type A. That's important. One question I always ask people is, if we can get you feeling better, what's the first thing you'll do? Like, if I could get your knee better or get your body-wide inflammation down, and that gives me an idea of what your expectations are. Obviously, what are your health issues, but not just your joint, overall. Is your A1C a little bit high? Do you have allergies that you're Not sure, some food sets you up. Well, there's testing for that. You can work on that. And then, of course, preference and compliance and cost. Some people are fine with the cost of peptides. They're not ready to commit to doing biologics. They are a little more expensive, and that's fine. There's lots of people who do great on those. So here's one example. And again, this is malleable. And, I got a lot of people. I don't know about you guys. Pickleball is crazy here. Everyone loves to play pickleball all of a sudden. For something that came out in the 60s, it's obviously made a resurgence. 50-something male, physically active, former college athlete, plays pickleball. Right knee pain, old meniscal damage. Right Achilles has wear and tear. You can see it on the ultrasound machine. What could you do? Well, I love Sermorelin. My experience is this trifecta has done wonders for me. Sermorelin, BPC 157, TB 500. Maybe start that out for a little while before. Then you can inject the birth tissue product, Restore and Rexo to the affected areas. Follow up with the injections over 6 weeks. Maybe consider a peptide combination for 3 months and then reevaluate. I'm giving you the the romper room simple version. Brent has more details. I'll often try like a 3-month course with a lot of the peptides, give them time, and then maybe reevaluate and see if they can benefit from more. That combo tends to work well. Next slide, please. Example, facial rejuvenation. Former history of smoking, got off smoking, stopped, realizes the mistakes of her youth, going out and tanning beds and getting as much sun as possible, wants to reduce fine lines, get softer, better hydrated skin. Well, if you do aesthetics, you probably know it's always a good idea to take pictures first so you can see what you started with and what you ended with. In case someone says, these haven't gotten any better, you can show them what they looked like before and say, Mrs. Wojciechowski, you look a lot better, What can you do? Well, you can do microneedling with the birth tissue products, with top and Audrey, who's helped set this up, as you know, is really great at the aesthetics. Copper peptides work very well for these. Topical BPC 157, inflammation wound repair. What I'll typically do then is once we've done the microneedling and put things topically, is you come out with a syringe and then the really fine lines, like the 11s, the glabellar region, marionette lines, smoker lines. You can take a 30 gauge needle and just basically fill those areas. Old scars, it's wonderful. My sister had a dog bite scar from childhood. A dachshund bit her. She had a scar the size of a postage stamp for 30 years. We injected product in there. 2 weeks later, we went on a trip together and I kept poking her face like this. She's like, what are you doing? I said, I've been looking at your face for decades. And now that thing is shrunk down to almost nothing. It was amazing. I like to charge products, a couple weeks later because it's a maintenance product and it continues the healing effect. Obviously, you want to advise them on nutrition, supplements, things like red light therapy, what to avoid, etc. I know that we have an AI program. You can do a facial scan. Audrey can talk to you about that. It will make you feel horrible about yourself. It'll tell you everything that's wrong with your face, but it will also tell you what you can do to fix it. It's really cool. The next one, please. These are my closing thoughts, and Brent, feel free to chime in. These are just things we tell everyone at every clinic. Know what you know what you don't know when to seek help. So like we say, don't fake it till you make it. There's nothing wrong with saying, I don't know. I'm very ignorant of a lot of peptides. I'm just scratched the surface. The Chinese say, he who asks is a fool for 5 minutes. He who never asks is a fool forever. There is no test out there, no MRI, no PET scan, X-ray that will trump a comprehensive history and exam. So if you don't put your hands on the patient, if you don't ask the right questions, if you don't examine them, you're never going to quite get it down. If you think their pain is based on what you see on the MRI, MRIs can be misleading. They can be very helpful, but they will, again, radiologists are scared of being sued. So they will note every ding and doink on that back or that shoulder, and that may have nothing to do with their pain. How many low backs have you guys seen? Brent, I'm sure you can see. It has nothing to do with their back. It's their SI joints, their piriformis, but they got disc bulges. So, hey, let's do fusion here, or let's do steroids there. And you realize it's not your back at all. It's down there. So good exams are really going to help you. I love that saying, a little knowledge is dangerous. Know your limits and know when to call for help. I know now when to call Brent and say, Brent, this peptide, contraindications, what would you do in this case? And that's how you get smarter, by not being the smartest guy in the room. So build your repertoire. I know people who just start with appendicular joints. They'll start with knees and knees and shoulders, and then they'll go to lumbar spine, then they'll go to cervical spine, the things that are a little scarier. Document everything, every conversation, everything. Because my memory is that of a goldfish. So I don't remember what we talked about last week, but I can tell you, how did the patient do, what they feel, what symptoms did they have. It's all on our EMR. Follow-up is crucial. I think everyone here is because you care. if you're in this just for the money, this is the wrong field for you. You really have to care about people. Why else would you put up with the stress of learning this much? So again, 24 hours, 72 hours, 1 week, 4 weeks, 6 weeks, 3 months, 6 months. Why 6 months? They may be great, but you call them up and say, hey, just want to see how you are. It's great to get feedback that they're doing well. It's also great. A lot of people will say, I've been meaning to call you. Now that my back is better, I've got some systemic issue. Maybe you could help me. So you remind people to come back to you. Lastly, there is a lot to functional medicine. I love ozone therapy. It's one of my mainstays. Bioidentical hormone therapy, ionic foot paths, IV therapy. There's a lot you can add. Consider incorporating that into your practice. There's really a place for everything under the sun, and for different people, different expectations, and different price points. Next one, please. Next slide, please. Was that it?
This is the next slide.
Oh, that is. I'm sorry. This is the last one. Brent, anything you'd like to add?
Well, I think you nailed it, but my whole presentation and what I tell patients is don't complicate things either. We know that lifestyle is medicine. We know that everything we need to heal is on this earth. Sometimes we complicate things by not controlling what we can, and that is yourself. And if you start with lifestyle, these modalities, biologics and peptides, are going to work in your life if you're going to go at life aggressively. And that's what this is about feeling the best you can, looking the best you can, and enjoying your health span. And so, don't settle with not feeling your best. There are solutions if it's some sort of inability with anatomy or musculoskeletal. Biologics could be a huge lift for that. For instance, I have no what is the word in the knees?
Cartilage?
Yes.
This guy? Okay.
I have no cartilage in my knee, but I've had stem cells in my knee 3 times, and I have no pain. So my next move, if my knee has pain, is a knee replacement. But it's been 4 years and I have no pain, and that's a great example. And that is one of the hallmarks of biologics and joints, is that even though you're cartilage, bone on bone, for some reason, a high percentage of patients that get biologics do not have pain.
Yep.
And you support that with peptides to reduce body fat, to take the load off the joints, to improve sleep, to improve repair. So all of these things can work to your advantage, but you're also trying to prevent this from happening. So stick to lifestyle, work really hard on what you can control, and when something doesn't go the right way, you have peptides and biologics to fall back on to keep you moving forward. So that is the name of the game.
Yep. You've all heard that thing. What are the 7 best doctors? Sunshine, water, rest, fresh air, exercise, diet, and self-respect. Something. Without those, if you don't control your sleeping habits, if you don't get some exercise, if you don't find a way to laugh, nothing we give you is going to help you. I like this quote by Joe Dispenza. I'm a big believer in what he does. It starts with your beliefs in yourself and what you do. When your thoughts change your feelings change your actions. Your character is your destiny. Change your action, change your life, and this becomes a whole lot easier. Like Brent said, I don't know I haven't had an knee X-ray in a long time. 40 odd years of martial arts and gymnastics. I'm sure they're not pretty, but my knees are good. And I know, well, look, what do the products do? They have an anti-inflammatory effect. They have hyaluronic acid, which is way stronger than the gel shots. I've hit the ligaments and tendons around it. So it's a stable knee. It's a lubricated knee. It's not a painful knee. And I know it's not morphine that's just dulling my pain signal. So it's amazing the number of cases you'll get where people just look and you're like, oh my God, that joint looks like a train wreck. And yet they're doing better. They do well. So, you're not harming them. You're not fooling the body. It's not just a painkiller. So don't let that stop you. Take each patient individually. Well, guys, thank you from all of us. We really appreciate you coming.
And we will be posting or sending this out to everybody, the recap and some resources for you. So be looking for that in your email. And if there's any other topic you'd like us to consider in a future webinar, just shoot us an email or put it in the chat. Let Casey know. Thank you.
Thanks, guys.
Thank you, everybody.
Thanks.